Hello, this is Dr. Bob, Anthony, and Casey and DeMaria, once again bringing you a half off health. And tonight, we're going to talk about some very, very serious information. We're talking about breast cancer, but we're going to also talk about male breast cancer also. Do you know that over 2,000 men every year get breast cancer? Do you know that over 200 die every year because of breast cancer? That's kind of frightening, I would have to say. I've been really blessed. I've written 7 books, and this one particular book is what will be a part of our focus tonight, is Dr. Bob's Drugless Guide to Balancing Female Hormones. We also have a book called Dr. Bob's Men's Health, The Basics. So if you know a male in your life right now that probably is having some health challenges, statistically, men between 60 and 70 years old tend to have breast cancer. They usually are overweight. Their abdomen, this belly that they have, creates estrogen. But we're going to talk about a lot of different things. Dr. Anthony and Dr. Casey and I are going to have this discussion. And I think the very most important area that we'll start with is something as simple as, and I learned this from a friend of mine, his name is Dr. David Fram. He wrote a book, The Cancer Battle Plan. And in his book, he made a comment. He said, if we could determine the pattern of a condition and reverse the pattern, we could reverse the condition. Pretty basic, wouldn't you guys say? Mm-hmm. So the very first pattern we're going to talk about today is low thyroid, subthyroid function. I know 72% of you right now watching me have inefficient iodine. You say, what does that mean, Dr. Bob? Well, the iodine is important for your thyroid gland, and I know Dr. Anthony has a couple comments about just some areas that's going to really impact. So pay attention. Call somebody up and tell them they need to watch this.
So what I'm holding right here is a shower dechlorinator, and this is so vitally important for every single person that's out there, because all of you, when you're showering in the morning, are actually showering in a gas chamber of chlorine gas. And why that's important, because the chlorine is in the water. And bromine, chlorine, and fluorine are all antagonistic to iodine. We'll say, well, why is that important? Well, iodine supports thyroid function. If you don't have proper amount of iodine, your thyroid's not going to be working properly. And as we're going to go through here in a little bit, the thyroid is so important for that pattern that Dr. Bob was talking about in the cancer battle plan, because if the thyroid is not working, it is the beginning of the downhill slope for the breast cancer pattern.
Why don't you show them that dechlorinator, how it works?
So this is a dechlorinator, and we sell these in our office. I know that Dr. Bob has them. Dr. Kaysen and myself also use these, and what it does is you put this on the end of the shower spigot, and it takes the chlorine out of the water so that you can shower without chlorine in the water. And I know that when you're using this particular item, it makes such a huge difference just on how your skin feels, how your hair feels, because they're taking those chemicals, that chlorine that's in the water, and taking it out. But this is also an important principle for those of you who have swimming pools that use bromine and or chlorine, and you can use those in a swimming pool or a hot tub, because those are all going to be antagonistic to the thyroid gland.
And another area is even toothpaste. I know that we have available on our website, druglessdoctor.com, fluoride-free toothpaste. And I've had conversations with various radio hosts that make sure that they have their fluoride treatments, etc. And I could tell you that I know that Dr. Anthony has never had a fluoride treatment, and I know that his teeth are essentially 100% normal. I haven't had a filling in my mouth in probably 30 or 40 years, and I don't have fluoride treatment. So bromine, fluorine, and chlorine are antagonistic to iodine. Some body signals for low thyroid or subpar thyroid function: cold hands and cold feet, wide spaced teeth, thinning hair, high cholesterol, and constipation. The issue with the thyroid gland, if it's not functioning optimally, you're going to be constipated. All of you right now should have pooped at least once today, preferably twice. If you're putting your head down and say, hey, I haven't pooped in 2 or 3 days, that is not good. You want to poop twice a day. For those of you that do it 3 times a day, you should be celebrating right now because, see, you want that stool to leave your body. It's a process called auto-intoxication. So if you have cold hands and cold feet, wide-spaced teeth, thinning hair, yellow teeth, thinning eyebrows, constipation and high cholesterol, subpar thyroid function, we talk about it in great detail. I know a lot of you are taking Synthroid and other thyroid medications right now. Not to drop this bomb on you, but when women are menopausal and they're taking Synthroid, it increases osteoporosis. I'll say that again because I'm talking to you. If you're menopausal and you're taking Synthroid, which I know at least 1/3 of you are, or 72% of you don't have enough iodine, you have a greater chance to get osteoporosis. So when you're constipated, Dr. Kaysen's going to tell you, it stresses your liver. And your liver is a very important organ, and there's some foods that we encourage our patients to take that's going to help optimal liver function. And the liver is important because it processes the estrogen, because 95% of all breast cancer is due to too much estrogen.
Okay, so your liver is like your oil filter in your body. So it's used to detoxify everything that you're putting on your body or putting into your body. So a lot of people will ask, well, how do I detoxify my liver? So an easy thing to do is Dr. Bob's ABCs, which if you've read the Female Hormone book, you know about this, but this is for those people that haven't. So what you're gonna do is you're gonna eat a half of a red apple a day. And you always want to do organic, because if you're not doing organic, then you're putting all of those chemicals right into your body. And we suggest a red apple because a green apple is going to stagnate your digestion. The next step you're going to do is you're going to eat a quarter cup of beets during the day, either baked, also you can do raw beets, and then you're going to do 4 or 5 baby carrots organic also during the day. And I know that a lot of females do this every day, and including us, we eat beets every day, but it really helps with getting your digestion working. It helps with regular bowel movements. It's helping getting out all those extra toxins that get congested in your liver.
What's kind of interesting what Dr. Kaysen said, do you know that you can lower your cholesterol 40% by eating beet fiber every day? So if you add the half an apple every day and the beets, you can lower your cholesterol over 50%. And that's higher than the statistics that I hear on the radio from statin drugs. And what's really interesting about statin drugs, one of their bad effects, yes, drugs have bad effects. And if you listen to some of these drug advertisements, it can kill you. They'll always say, and death. They always use a real quiet voice. But we're here to tell you, eat a half a red apple every day, 1/3 cup of beets, 4 or 5 baby carrots. Your liver is going to love you. So 95% of all breast cancer is caused by too much estrogen. Some common body signals from too much estrogen is tender breast, heavy menstrual flow, varicose veins, spider veins, and hemorrhoids. Now, I don't want to be the bearer of bad news, but if your liver is compromised, see, the blood flows through your legs, up through your liver on the way to your heart. If your liver is plugged up or it's compromised, you're going to get varicose veins. Well, you can go and have your veins stripped, and guess what? In 3 to 5 years, you're going to need to have it done again. And so what our goal and our objective is to help improve optimal liver function. So Dr. Anthony, you have the spine in front of you, and I know that because we practice clinically as chiropractors, and I also have a Doctor of Natural Health degree, you could even talk about L1 and constipation. You can talk the spine is so important, integral part of your health.
So one of the things that we've been blessed to learn about the body is that it heals itself. A lot of people, they'll come to us and they get better, and they'll say, you know, that Dr. Bob, Dr. Kaysen, Dr. Anthony, they're miracle workers. Well, the miracle worker is inside of you. What we help to do is we create that environment of healing inside of your body by getting rid of some of the interference that exists, whether it be physical, chemical, or emotional. So what we've been blessed to be able to teach our patients is that their bodies heal themselves. They just need no interference. And you can say, well, what is he talking about, interference? So your brain, like we've talked about before, sits in top of the skull and it continues as the spinal cord. This is really important. That's sending life energy and nerve messages all the way to the rest of your body organs, muscles, and tissues that are there in the inside. If you can have a physical misalignment of your spine, what we call a subluxation, and that subluxation is causing you not to have optimal function. So one of the things we do as chiropractors, and one of the most primary things we do, is we adjust the spine and look at the nervous system, because if we can get the nervous system functioning better, we know that your body has the potential to heal itself given the right environment. So all of these things that we've been talking about, the apples, the beets, and the carrots, those are part of the chemical part of the interference, and we're trying to build that up. So I know that when people come to our office and they hear us talk, you know, they are piecing things together. And I think what you said was really important at the beginning was tying a big picture together for everybody, because we talk a little bit about everything, but the thyroid's important because the thyroid stops you from pooping and you could be constipated. Then your liver has to work overtime to get rid of some of that excess waste that's in your body. And the liver is not able to process the estrogen. And that extra estrogen is what's going to be one of the common causes of breast cancer. So we use a product in our office to help do that. It's a B vitamin. It's called B complex. So that'll be really good to support liver function.
That's a lot, but you really think about what we just did. 45,000 women die of breast cancer every year. The leading cause of breast cancer, as Dr. Anthony said, happens to be too much estrogen. So a couple thoughts just to chew on and to think about. The average female puts 125 to 150 different chemicals on her body every day. So ladies and gentlemen, I want you to start looking at the ingredients and the products that you're applying to yourself. See, when Dr. Anthony talked about the 4x5 gas chamber, when you have that hot water, whatever you're putting on your body is absorbed into your body. That is just so vitally important, and I just need you to wrap your brains around that. And when we talk, and if you have a church or a business organization, we would love to be able to come in and talk to you about health and optimal wellness. Well, we always just look at the people in the crowd, and if we notice little skin tabs around their neck, I know that they probably are toxic. So we're going to take a short break. We're going to come back. We have so much more information to talk to you about. This is very, very serious, and I want to make, and we want to make a difference in your lives. We'll be right back. Hello, this is Dr. Bob Anthony and Kason DeMaria. Welcome once again to our Half Off Health program. And tonight we've been talking about a very serious and important subject. It's breast cancer. And we briefly touched about men and breast cancer. Do you know that 2,000 men get breast cancer every year and over 210 die? It's a frightening thought, isn't it? Well, I've been blessed to have written 7 books, and this book here is Dr. Bob's Drugless Guide to Balancing Female Hormones, and Dr. Bob's Men's Health, the Basics. We talk about cancer, we talk about health. We don't treat cancer in our practice. What we do is we help the body heal itself. So when the body immune system is strong, the body is able to literally cannibalize cancer cells. What I'm holding in my hand right now is sugar. Sugar is your nemesis. Sugar causes inflammation in the body. Sugar paralyzes your white blood cells from eating unwanted, unfriendly bacteria and viruses and cancer cells. What we have found, anytime I have conversation or consultation with a patient with a history of cancer, they passionately are addicted to it. I know right now that you have consumed at least 28 teaspoons of sugar today alone. That's over a half a cup of sugar. Do you crave sugar? I know you do, because you're sitting there on the couch or by your computer. You're eating it. If you're passionately addicted to it, you need something called C-arzyme. It's a product that we use called chromium, or an herb called gymnema. If you've had your gallbladder out, I know you're for sure are going to crave sugar. If you had your gallbladder out, you're probably a female over 35 years old with 2 children. The liver makes bile. Your gallbladder is the reservoir of bile. Bile emulsifies or breaks down the fat in your body. If you don't have a gallbladder, or if your liver is very compromised, you have a big tummy, you have a passion for, or you have problems with green peppers or radishes, those are body signals of liver gallbladder distress, you're always craving sugar. Now listen, because I've never talked about this on a program before. You have a glucose molecule. That glucose molecule can be covered with fat. It's covered with fat because if your gallbladder has been removed, or your gallbladder is not working, your body doesn't see glucose, it sees a layer of fat. So you're craving sugar. So you really want to give our office a call if you had your gallbladder out. It's really a matter of life or death, because people who have their gallbladder out have a greater chance to have cancer and heart disease. And I know you don't want either of those. And Dr. Kaysen has a couple items that she's going to talk about that we see really allow cancer to grow in a person's body.
Yes, I'm just thinking about the sugar. It's funny because some people, they try to hide that they've had a cookie or a piece of pie or a piece of cake, but we know even by asking them that they have sugar in their body. A lot of people have left mid-back and neck pain due to eating things like bananas or berries, melons, pineapple. All of those things can increase pain in your body and inflammation because of how the pancreas refers to that left mid-back and neck. So a lot of people in our office, we see this jump response, or that they're in a lot of pain because of the foods that they're eating causing subluxations in their spines. But other things that you want to avoid are soy. Men and females should never consume soy in their body. This increases estrogen in your body, which is clogging up the liver. Specifically in men, you're going to be increasing your breast tissue, and in females, they'll be increasing their breast tissue also at a younger age. I know a lot of women's and magazines and health magazines, they promote soy, but in our office, we do not promote soy at all.
And it's kind of interesting just to add on to the soy, because this is kind of controversial, and I know that there are some vegans and vegetarians out there that want to send us some kind of email. And you can send us some email, that's okay. But when they create and they process soy, they heat it to high temperatures. So it eliminates an enzyme called trypsin. And also, soy depletes the body of zinc. I know 30% of the females in our society today have a zinc deficiency. Zinc is really important for optimal function inside of your body. So we do not promote wheat, we do not promote soy products ever. Animals should not even eat soy, because see, whatever the animal eats, you eat impacts you. And I know you might be 60 years old or older and think, geez, Dr. Bob, how do I get my estrogen? We help support adrenal gland function, and we talk about that in great detail in Dr. Bob's Drugless Guide to Balancing Female Hormones. So something else you have there, Dr. Kaysen.
Something else, especially when you're grocery shopping, you really want to look at what you're putting in your cart. I know a lot of people, they are even looking for organic things that are in cans, but you really want to watch out for cans because of the lining. There's this BPA lining in there, which is a chemical that changes the hormones in your body, that increases the estrogen in your body. I know also when you're heating food in the microwave, TV dinners, cans, water bottles even, all of these things have chemicals that are mimicking estrogen in your body. So just something else that you want to make sure that you're looking out for.
It's kind of amazing. We had an event that we were speaking at the other day, and yes, we do come to churches and businesses and organizations. And we happened to be at a very major health food store here in northern Ohio, and the owner of the store said that Eden products, E-D-E-N, is BPA free. So you want to start looking for a BPA free. But there are even some other items it's not about we don't want you to eat food. We're just trying to increase your awareness so you can make wise choices. Right, Dr. Anthony?
Yeah, I think one of the things that Dr. Kaysen said that's so really important is talking about the toxins, because we've been talking about a lot of stuff here today that it's all really important. How the thyroid affects how you poop, and it affects liver function. But the thing that's really important is, especially if you're a female, the products that you're putting on your skin, the things that you're consuming that have BPA in them, or the soy, all work on tipping the estrogen scale in the wrong direction. So what we're really trying to do is we're trying to promote healing inside your body. So these healthy tips that we're giving you are all really important, and it's time to take this really serious. So if you've been watching us for a period of time, which a lot of patients that come and see us, today is your day. You're never going to be younger than you are today. And if you want to be here for the grandkids, we want you to come and see us so that we can promote healing inside of your body. This is a really important subject because cancer affects a lot of people. And then when we can help support your body through proper adjustments with getting the nervous system functioning and supporting those chemical deficiencies that you have inside of your body with proper nutrition, we can make a lasting change in your life. So one of the things that I wanted to share with you is something that you really need to avoid is this thing in this bottle right here is soda. Whether it be diet soda or regular soda, there is things that are in here that are causing you not to be at optimum function. So you might be tired in the afternoon, and it's because you're consuming too much sugar, high fructose corn syrup, sodium benzoate, all those additives in here, even the caramel coloring that contains gluten are all inside of this right here. If you were to see the amount of sugar that was inside of here, I would hold my finger up to that spot right there, and all that sugar that is inside of this alone is causing your immune system not to function at the proper level that it is. So when we talk about all these things, we're taking it very serious because we know that we are saving lives and impacting people when they come to see us. So today is your day. Call that number on the screen because you are so ready to have that life change.
I'll tell you, one other thing about soda pop is it has phosphoric acid in it, and phosphoric acid causes the bubbles, and that phosphoric acid can cause osteoporosis. And another side note, if you're taking Synthroid, which I know a lot of you ladies are taking Synthroid and you're menopausal women who are on Synthroid have a greater chance to have osteoporosis. Copper. Do you have freckles? People who have freckles have high copper. There's a great book called Why Am I Always Tired by Ann Louise Gittleman. Ann Louise Gittleman wrote the foreword to my ADHD book. When I was reading her book about why am I always so tired, she talked about copper. And people who are vegetarians tend to have higher copper. They have digestive distress. But when you have high copper, you're going to have thick, pasty bile. We had talked about that at the beginning of this segment. Do you have freckles? Do you have red hair? Do you have a hard time falling asleep at night, where your body's physically exhausted, but you're laying there in bed and your brain's going 100 miles an hour because you can't fall asleep? That is one of the reasons that we suggest that you avoid wheat and soy, because wheat and soy deplete the body of zinc and increase copper. In zinc, 30% of you watching us right now have a deficiency of zinc. Zinc's important for all the mechanics that everybody has been talking about so far tonight. And in our practice, we have a product called aqueous zinc that we could literally test you for